afternoon, ma'am. I am Gladys ABALA po from BSN2C Group 1. And today, I will be going to perform the return demonstration for nasogastric tube insertion, gavage, lavage, and removal. So, I'm sorry po if nakaupo po ako. It's just to maximize the space and to be able to present well the procedure with the patient being seen in the camera. Then, next is purpose. So we're going to the purpose of this procedure is to administer tube feedings and medications the client unable to eat by mouth or swallow a sufficient diet without aspirating foods or fluids into the lungs. Then we're going to establish a means for suctioning stomach contents to prevent gastric distension, nausea, and vomiting, to remove stomach contents for laboratory analysis, and of course to lavage or wash the stomach in case of poisoning or overdose of medications. Then next is we're going to assess the client's history of nasal surgery or deviated septum, assess the patency of the nares, the presence of gag reflex, and assess the mental status or ability of the client to coordinate with the procedure. The next is planning. So we're going to determine the size of the tube to be inserted and whether the tube is to be attached to a suction. The next is implementation preparation. So we're going to assess the client to a high Fowler's position if the condition of the client permits, and to support the head on a pillow. Then place a towel or disposable pad across the client's chest. The next is we're now going to proceed with NGT insertion. So first is to confirm the physician's order. The next is to identify the client and introduce yourself. So magandang umaga po, ma'am. Ano po ba ang pangalan mo? Kailan ka po pinanganak? So, ako nga po pala si Gladys ABALA from CSPC and ako po ang student nurse mo ngayon. Then, next is to provide for privacy. So, by draping the client or by closing the window, the door, I mean. Then, explain the procedure to the client. Then, perform hand washing thoroughly. Then, don appropriate PPE. Then, prepare the equipment. So, the equipments are personal protective equipment, gastric tube, water-soluble lubricant, stethoscope, pH test strips, more than 35 ml of syringe or catheter for adult, tape, kidney basin, cap with water and straw, safety pin, tank depressor, clamp, suction canister, suction liner, tubing, 5-in-1 connector, suction feeding pump if needed, and disposable absorbent pad, flashlight or pen light, skin protectant, and lastly is measuring tape. So first, we're going to position the client. So high Fowler's position. Then after that, we're going to place a towel or absorbent pad over the client's chest. Then after that, we're going to select the appropriate size of the tube. Then after that we're going to determine the appropriate insertion length. So by measuring from the tip of the nose to the ear of the client, then here at the stomach. Then we're going to mark the length. Then next is to cleanse and dry the bridge of the nose and apply skin protection. So we're going to cleanse the bridge of the nose. Then after that, we're now going to examine the nostrils for deformity or obstruction by closing the one nostril and then the other, and asking the client to breathe through the nose. You can examine na muna. Then ask the client to close the one nostril or the one nose. So then this is applicable only for conscious space. Then we're going to lubricate the tube with water soluble lubricant. Lubricate. Then we're going to flex the client's head forward, tilt the tip of the nose upward, and pass the tube gently into the nose as far as the back of the tooth, and guide the tube to straight back. So, assuming na lang po na nakaka-insert yung tube. So, insert na. Then, once the tube reaches the nasopharynx, so allow the client to lower his head slightly. Then, after that po, then we're going to instruct the client to swallow as the tube advances. So we're going to use a cup with straw. So papasipin po natin sa patient ng straw while swallowing. So we're going to insert the tube. Then if the patient begins to cough or turn cyanotic, so we're going to withdraw the tube immediately. Then after that, if obstruction is felt, so we're going to pull out the tube and try the other nostril. Then advance the tube as far as the mark insertion point. So we're going to advance. So sige, na-advance po. So, until the mark insertion point. Then check the back of the client's throat to make sure that the tube is not curved into the throat. So, kapag hindi nakikita, we're going to use a pen light. Then, we're going to check the correct placement of the nasogastric tube by using the two or more of the following. So, first is to aspirate the for stomach contents. So, assuming na lang pong nakalagay ito. Then, we're going to check the pH test or pH test of the aspirated stomach contents. So, kaya nga meron tayong pH test strips. Then, we're going to inject 30 ml of air with a stethoscope over the stomach area, listening for a whoosh sounds. Assuming na lang po nakakorek. So, ayun, may whoosh sounds na. So, maximum amount of air to instill. So, for adult, 10 to 20 ml. For child, 5 to 10 ml. For neonate, 1 to 2 ml. Then, this is only sa correct placement. Pwede din yung by through x-ray. Then we're going to secure the tube with a tape or a commercially prepared tube holder over the stomach. I mean, if the placement is now correct. So we're going to secure that. Then we're going to connect the tube to a drainage. We're going to connect the tube to a drainage or specific suction or if feed is ordered. So, ganito po yan. Kapag may order na may feeding. So, we're going to put it here. Then, remove this. Then, fasten the tube loosely to the client's gown with a safety pin. Then, assuming na po naka-attach na, or then we're going to remove it. Then, assist the client to a comfortable position. We're going to administer oral hygiene or cleanse the nostril of the client. Comfortable position. Then, we're now going to remove the gloves and perform hand washing, of course. Then, to record the procedure time. Thank you po.